Hey, welcome. I'm Diana Braun, founder of the Knee Zone. I am joined today by Dr. Raj Sinha, my husband.
So as Diana said, I am her husband. My name is Raj Sinha. I'm an orthopedic surgeon. I've been in practice now for 29 years. I have had the pleasure of taking care of hundreds of thousands of patients uh, over those almost 2.5, 3 decades. I've specialized in hip and knee replacement specifically, and I've also had the privilege to design hip and knee replacement devices that have been used worldwide. We estimate about 1.5 million people around the world are walking around with implants that I help to invent, create, or design. So I know a little bit about the subject. I've also been involved in a lot of the cutting edge stuff that's come about over the last 2 decades or so. I think one of the questions that we're going to talk about is something that is allegedly new, but not so new. And I'll tell you a little bit about that. You want to read
Yeah.
out the question?
Yeah. We had two questions that came in on posts before this. So we're going to answer those two first. Cheryl has rheumatoid arthritis, and I understand that as a result, it may have had some impact on my slow progress. Let's talk about that. I am 8 weeks post-op. Her extension is excellent. However, so when you say that, so you're at 0 degrees, like you're zero straightening, if you want to confirm that for us. My bend is only at 80 degrees. I am walking most often without any assistance. I'm using a bike to improve my bend, and I'm able to pedal 10 rotations slowly. Should I be worried? Ice and elevate always. What else should I do? I'm going to let you start and give Cheryl some suggestions here.
So, a couple quick things right off the bat for rheumatoid arthritis patients. Number one, if you're 8 weeks out, you should be back on your rheumatoid arthritis regimen. Whether that's Humira or one of those other medications, one of the what they call disease-modifying anti-rheumatic drugs. You should already be back on that because your wound should be sufficiently healed. Typically, we say a 3 week holiday before surgery, and you can resume it about 2 weeks after surgery. So that's issue number one. Issue number two is what was your bending before the surgery?
Mm.
There's a general rule of thumb that whatever your preoperative degree of flexion was is about what you're going to get postoperative. Now that's not exactly true anymore because of again the pain management blocks and things like that. People actually do better than they did historically, but that's a fairly reasonable rule of thumb. The trick that I recommend to people when they're struggling with the bending is to actually get onto like a club chair or some sort of padded chair that has a back and use your body weight to help flex your knees because the amount of pressure you can generate from your body weight is it's a lot more than a therapist can generate for you.
Are you talking about like kneeling on?
Kneeling,
Okay,
yeah.
yeah.
It's like a couple other things too. Number one is, are you beating it up too much?
Yeah.
There is such a thing as overdoing it, and your knee never has a chance to rest, and so the tissues are just always irritated and inflamed and swollen. So, think about that. I've had patients come in and say, "I'm doing my exercises 5 times a day. I don't know why I can't get better." I'm like, 5 times a day? You only need to do them 2 times a day at most. Where did this 5 times a day come from?
More is not better.
More is not better in this situation. That's the other thing. And the last thing I would say is talk to your doctors about steroids. Short course steroids, particularly for rheumatoid patients, make a big difference in pain and inflammation. So those things may help you.
Yeah. I love that she's using the bike. I'm a huge biking fan. Um, I would I would hazard a guess if you're not overdoing it is maybe set a timer for 10 minutes twice a day on your bike. See if that helps a little bit more. But I will absolutely send our kneeling protocol to give you another chance to get a little slow weight descending on your knees. And we'll talk about how to pad the chair and do all that. But I do think that that would help you as well. All right, y'all. Thanks for joining us today, and we'll be again soon. Thanks.